And I'd like to, us to introduce our guests. So could I invite Madam Florence to just briefly say hi, followed by Mbugua, then we can start. Thank you.
Thank you, Christy. A warm good evening to everyone. It's a pleasure to be here this afternoon and happy to interact with students of Strathmore University. I am a counseling psychologist. I've been in the profession for 10 years plus. So I enjoy working with people and ensuring that people maintain mental health. I work with different types of clients. So I work with developmental issues. So it means I work with children from 3 years, developmentally, adolescents, young adults. And in the process, I also work with loss and grief issues that are very difficult, trauma. So loss and grief falls under trauma. Very passionate about marriage and families as well. And so at the moment, currently in Strathmore, I work from SUMC, but during COVID, we've had to work from home, meaning that a lot of my sessions have been on Zoom because the environment in the clinic is not well ventilated for me to work with clients. So there has been a shift in terms of the kind of services we offer. But very happy to be here and ready to look at the topic of the day. Asante sana, Christy.
Thank you, Madam Florence. Mbugua.
Hi, good evening, everyone. My name is Mbugua Kibe, and I don't have a lot to say under my own plate because I'm not a psychologist or anything. I'm just currently a student at Strathmore. Okay, I can't say I'm currently a student at Strathmore because I'm in the middle of changing courses, so I'm kind of in a limbo with administrations. But yes, I'm a student at Strathmore. I had been with Strathmore for the past 2 years now. And all I can say is that I'm very passionate about mental health also, and helping everyone understand what it entails and answering people's questions concerning it. Yeah, that's all I can say for now. Thank you.
Thank you, Mbugua. So I'd just like to kickstart with the most basic of questions, and I think this will be to Madam Florence. What is therapy?
Therapy generally, if we look at it from the very general perspective, therapy refers to how mental health disorders or mental health issues are treated, not the word treated. And they are treated with the hope, with the knowledge of a base of psychology. So you can't offer treatment without understanding what psychology entails. And psychology, actually, the two words means the psyche, the mind, basically. So how does the mind operate? It is very important for someone to know that. So the components of therapy include the issues that we bring. It could be mental disorders. It could be normal issues, because there's a borderline between the normal issues of life. So normal issues of life could be, I'm struggling. Let me use Mbugua, basically. Mbugua is in the transition. So you can choose to process that transition, what it means to you, how it's affecting you, what challenges it's bringing on the table. So those are normal day-to-day issues that human beings struggle. At the end of the continuum, there's the mental illness. So therapy works across that continuum, and with the aim of people being able to live fulfilling and meaningful lives. Basically, that's what therapy means. And in the treatment, there are different types of modalities. It is important to understand that. Thank you, Christy.
Thank you, Madam Florence. So following from that, then I would also ask, who administers therapy?
So we have to understand therapy, again, is a broad term. There are different types of therapies. So there's the biomedical therapies. Doctors administer biomedical therapies because they are trained and they are knowledgeable in the field of medicine. So the biological because the human being is wired from that perspective. There's also the psychological therapies, and the psychological therapies are normally offered by a counseling psychologist, a clinical psychologist. So both the two currently in our context are given the permission to offer the psychological therapies. So we have to separate and be specific in terms of psychological aspect.
Okay, thank you for that. I also want to ask Mbugua, what do you think therapy is? If someone asks you what's therapy, what do you think? How would you respond?
Okay. When I say what therapy is, it's easier for me to explain it in terms of like a small story. So I want you to understand that there are times when people can get sick in whatever form, either physically or mentally. And during that time, it depends on the severity of it. Like, say that you are stung by a bee and you're not severely allergic to bee stings, you can easily treat that with an antihistamine you can get over the counter. So same thing, you could feel a bit sad sometimes and you might talk to a friend instead of seeking help from a psychologist or a psychotherapist or anyone in that field. But then if you break a leg or something, you cannot just treat that on your own. You have to go to see a professional for that kind of thing. So it's the same thing for some mental illnesses where you feel overwhelmed and you need professional help to try and at least figure out where you are at the time. So for me, therapy would be the time when you acknowledge that whatever you're going through, you cannot do it on your own, and that you need the help of someone who is trained professionally to be able to help you. So that's my description of therapy.
Okay. As we continue, if you have any questions that would arise within the event, you can post them on the chat. You can also direct message me, or you can direct message a host, and then we'll be answering the questions in intervals. Yes, so we want it to be a very interactive session, we want it to be very informative to you so that you're able to get more understanding about therapy, the different types of services you may need, and just be able to be informed. Yes. I'll just keep going back and forth between you and Madam Florence. So Madam Florence, you had mentioned the different types of therapy. So what therapy does Strathmore Medical Center offer?
Psychological therapy, is that what you mean? What type of therapy?
Yeah.
Or you see, therapy is a very broad term. So if you come to me as a psychologist, it is important to know that they are different forms of therapies. So one, there's the cognitive therapy. What does cognitive therapy aim? Cognitive therapy challenges your thinking because the human person is wired under the feeling and thinking, very key components in mental health. So every experience that we go through in life, especially the challenging experiences, even the positive experiences will always elicit an emotion. So when the emotions are positive, clearly there are usually no problems. It is only when the experience is difficult and the emotions equally become difficult. So we start having emotions like anxiety. We start having emotions like anger. We start having deep emotions that shake our core. So the person will be able to help the client look at how the mind and the emotions work together. So a cognitive therapist challenges. So for example, if you say, I think I'm going to fail an exam, a cognitive therapist will want to understand what exactly you mean by you think you're going to fail, because clearly there has to be a reason behind your thinking. Maybe there's also an experience behind it. So a cognitive therapy will help you understand that. And clearly you realize that if you feel you're going to fail an exam for one reason or another, anxiety automatically comes up. And that anxiety is because of many other reasons pegged to your thinking. So the cognitive therapist. There's also the behavioral therapist. And the behavioral therapist works with behavior. So a therapist will want to understand why somebody is getting addicted. That behavior, where is it coming from? So sometimes we have learned, so remember behaviors are learned, and therapy will help you unlearn those behaviors and relearn new healthy ways of coping. So there's the behavioral therapists. There's also the, the psychoanalytic therapies. Psychoanalytic therapies tend to look at, they go back into your past to try and understand your past, because psychoanalytic therapies believe that childhood experiences are key. So if you come to me and you're presenting certain behaviors, sometimes I want to understand where it is coming from. And a lot of times when we go back and we go back and we go back, sometimes we realize that some of these challenges that we are facing were generational. So you realize that they run generationally. And so you are affected, but you might not be aware about that until you approach therapy, until you come and start to understand that aspect. And so the four key therapies are the behavioral therapists, the psychodynamic therapies, the cognitive therapies, and finally the person-centered or the client-centered therapy. So all these therapies have a meaning behind it, have a reasoning behind it, have a theory behind it. So client-centered, for example, will believe that the person has the powers to solve their challenges. Maybe they're struggling with different things here and there that is stopping them from being able to solve. But I believe that you're the person who is able to solve your problem. So I center more on the person and what they can achieve. But beyond the four major therapies, there are so many therapies. There's the Gestalt therapies, there's the EMDR therapies, there's the mindfulness therapies, all of them. However, you must have the base of psychology to be able to treat, not the word treatment. So when you come for therapy, it's not just a conversation that we're coming to have. It's not me coming to you and telling you, oh, we have a conversation around it. No, it's a treatment modality. So that is one thing that people have to understand, that all these therapies are treatment modalities to treat the problem, and eventually the client is able to come out. I don't know whether I've answered your question well.
Yes, you've answered my question very well. And I even want to key in a statistic I had gotten from the National Mental Health Foundation, is basically a UK-based foundation, where they said 1 in 8 adults seek mental health treatment, with 10.4% receiving medication and 3% receiving psychological therapy. It was also interesting to note that did now an analytical study and found between 2000 and 2014, the number of people seeking out to receive mental health treatment have actually increased, because in 2000, it was 23.1%. Then in 2007, it rose to 24.4%. And then in 2014, it rose to 37.3%. So you see that gradually, as we continue with our lives and experience different challenges, and the more we bring awareness on mental health awareness and just demystify a lot of challenges, a lot of myths, a lot of misconceptions, you find that more people are actually more open to seeking out mental health treatment. And what I loved about one of the things you said is that you don't necessarily have to be in a bad mental health state. You can just be in a positive mental health state, but want to figure out what's going on in your life, or want to learn how to process things better, or want to learn how do I process my anxiety, how can I manage my depression without necessarily hitting an episode before I start. So I really, really appreciate that. I think now I move on to Mbugua. So Mbugua, I would like you, if you're comfortable, to just share with us your therapy experience what made you seek therapy, and how has it been for you?
Okay. For my experience with therapy, I think I'm just gonna begin from when it all began. So sometime in, I actually remember it was January 2020. Yeah, I think it was last year, where a lot of things were going on in my life, and I had a small mental breakdown, and it wasn't my first one. So at this point, but this one was very, very bad, and I realized that I actually needed help for it. So I remembered during orientation back in 2018, they talked about the psychologist who was in school. That was Dr. Lucy. So I decided to try my luck and go and seek out her help the very next day after the episode. It was actually pure luck that I'd found her. I later found out that I had to make appointments first, that she's in on specific days. It was just pure luck that I found her. Then after we talked, she understood what was going on. I gave her like a summary of everything that was going on, how I was feeling. And afterwards, we decided to continue with psychotherapy until I was in a place where I got better. So we saw each other for the whole of 2020, and the beginning was physical before the pandemic actually hit and schools were closed. But after that, most of the other sessions were on Zoom or on WhatsApp. But for the therapy, most of it was me talking things out, explaining how I was feeling, what I was going through. And she would give inputs depending on what I had said, so that either so that she can understand what I said, or so that I myself can understand what I said. And after I got better, there was a lot of self-reflection on my end, and I realized the first time I had gone to Dr. Lucy was because I had depression, and one of the causes was that I was struggling with ADHD without actually realizing I had it for a very long time. So after that, we decided I told her that I suspected I had it. She did an analysis, and it was discovered that I do have ADHD. So now the choice was left to me whether to continue with therapy to learn how to better manage the ADHD. Just that we haven't started on it yet, but we're about to. Yeah, that's my journey for therapy. And how it has helped me as a person, it's helped me gain a lot of control, better understanding on myself, better control on my emotions. I can prevent a mental breakdown from ever happening again, even before it starts. Like I can see signs that something bad is going to come way in front of the horizon, and I can stop it before it comes in like a full storm. Yeah, that's how therapy has helped me. Was there another question?
Not quite. I just wanted you to share your therapy experience, what
Okay.
made you seek therapy, and then maybe if you wanted to add something.
No, I think I've said everything.
Okay, then I think because your trail of thought is in line with one of the questions, I would like to read a question I got from an audience member. They ask, do you really need to attend therapy, or can you help yourself through self-help books, positivity, and meditation? I think this is more for Madam Florence, or even Bugo if you have your 2 cents.
I was waiting for Mbogwa to respond, maybe to just respond from he's disappeared. Is it? Oh, Mbogwa, maybe just to him to share his experience. Without therapy, would he have managed? Maybe from that perspective, I can pick up the line. Of course, if he's comfortable to share.
Okay. Mbogwa?
What was the question?
The question was, do you really need therapy, or are you able to kind of sort of self-medicate with self-help books, motivation books, and meditation?
Oh, okay. I guess it depends with the individual. Because if you put it like that, it's like saying I was self-medicating for about 14 to 15 years before I finally got to a point where I'm like, okay, this is enough. I need help now. So, but now after getting more professional help, I'm able to understand myself better. I already mentioned that. So the question on self-medicating, I think it just depends on you, in the sense that if you acknowledge that you are not okay, do you also acknowledge can you gauge whether or not you can fix it by yourself, or you can get help from a friend, or if you need professional help? That's how you can gauge whether you need therapy or not.
Madam Florence had actually added a sort of question to you with regards to that.
Before you ask Cassie, for those people who are medicating and self-reading, what are they treating exactly? Even as they self-medicate, what are they treating? It's important to know what you're treating, because sometimes, especially if you have a mental disorder, remember, mental disorders don't have to be severe. Allow me to use an example. Most of us have gone to the market. I go to the market, you go to the market. And sometimes, unfortunately, you find people in our society who are called wendazimu, isn't it? They are on the severe end of the continuum. But there are other mental disorders that are very mild. You wouldn't even tell that you have, for example, ADHD, unless a professional tells you. Sometimes I'm saying, so if you know what you're treating and you're very sure you have a diagnosis, I'm not sure. So the question is, what are they treating in terms of self-medicating? What are they medicating? Are they exact that what they're treating is what they're treating? It's like going to the doctor. And then I tell the doctor, I have a stomach ache. So I've been taking this. Then the doctor does more tests and maybe discovers that there's a cancer in there. Can you see the difference? It's just an analogy that I'm using. But the question is, what are they people treating? Are they sure about what they are treating? So we have to separate the professional help from the normal day-to-day conversation that I can have with a friend. Those are two different things.
Okay, I think that's a very good distinction. And I like that from the very beginning, you've kept emphasizing that it's a treatment, it's treatment, it's treatment, it's treatment. So I think that's very good in line with that. So maybe to ask, at what point do you think someone should start therapy?
The most obvious is when you're not coping with normal day-to-day activities. Because remember, mental health demands that, one, we cope with our stressors, two, we are able to engage fully in our day-to-day activities. So the moment your day-to-day activities are being affected, so for example, being students, you suddenly realize you're not able to do class like you used to do. So you find yourself skipping class, you find yourself crying in the room rather than going to class. You find you're not handing in your assignments on time. And when you look at the end, you're seeing that you're going to rewind. Ideally, and note the word ideally, when you get to year one, unless there are any serious challenges, mental health demands that you move through the classes successfully, ideally. But if you're not, there are other specific special cases. Maybe parents don't have fees at that particular moment. That's different. I'm not talking about that kind of problem. I'm talking about problems where everything has been paid, it's your responsibility to go to class, but suddenly you're not attending class and you're not able to hand in your assignments on time. So if you look at your mark sheet or your record sheet, you're lagging behind. Why should you lag behind? Why? Unless, of course, there's a problem. So when you're not coping with your day-to-day life fully, start thinking of looking for someone to talk to. One, you can talk to a friend because it's not a professional. So you can come to Casti can come to you and say, Casti, I realize that I've I'm skipping class, I don't know what's happening. You see, you'll always hear that word, I don't know what's happening. You'll always hear it. And you might tell her, oh, try harder, go to class, pack your, I don't know, organize yourself. You can do all kinds of things, but it's persistent. So a persistent behavior that you observe that is especially on the negative. When they are positive, we are happy because when you're in a positive continuum, you're able to attend class, you do your thing. So we don't have issues with that. When you're not able to, so when you're not coping well, depending on the dynamics, it's important to start thinking about seeking help.
Okay, thank you for that. I have received 2 more questions. One question asks, can therapy help you understand yourself better?
Perfectly well. So therapy can give you an opportunity to understand yourself. So there's the concept of self-awareness. Self-awareness is understanding yourself for who you are. You understand your behaviors, you understand your personality, you understand why you do things the way you do them. And self-awareness aims at answering 4 questions. 1, who am I? 2, what am I? 3, where am I going? And 4, how do I get there? And when you become aware, I normally say it's a strength because you can choose to do something about it, intentionally choose to do something about it. So for this person who might not be attending class, they might not be self-aware of what is happening. But underneath, there could be something that is pushing them to get there. So when they come to therapy, therapy actually heightens your awareness of what is happening. And I like what Mbugwa said. Mbugwa said that now he can even stop the breakdown before it comes. It's because he's self-aware and he knows what to do when whatever happens. And so self-awareness is a powerful tool. Yes. And therapy can help you uncover self-awareness, your sense of self. Thank you, Kirsty.
Thank you. Also, someone had asked, and I guess it was in line with Mugwa sharing his story. What are the signs and symptoms of ADHD?
Okay, the signs and symptoms for ADHD are, I can say they're very different depending on the person. Because even when I was looking up these things, when I was writing my article that's on the website, I had seen that there are different kinds of ADHD. So it's a little difficult to tell. But primarily, ADHD could be, okay, the main things I can say are inattentiveness, where for things that you should be able to pay very good attention to. Like even if you can't say that if you're in a boring lecture, you wind up losing focus. That isn't an indication that you have ADHD. But if you're doing something that you genuinely enjoy, like reading or watching something, maybe a movie, and you're not concentrating, and there's nothing stopping you from concentrating, then that could be a problem. The second one should be restlessness, that you cannot sit still. Like you have no reason to move. In a situation where you should be able to sit still, like when you're on vacation or when you're relaxing, you just cannot sit still. That might be another indication. But like I said, there are different problems. There are different kinds of ADHD with different combinations of symptoms. So the only way you can be sure is if you take an evaluation, and I think you can get one off WHO's website. They have free ones where you can diagnose yourself. And depending on what the results say, they don't even give you a complete analysis. They just say there's a probability that you have ADHD or ADD or anything like that. So we suggest that you seek professional help so that you know more. And yeah, that's the main, I think that's the main way you can tell if you have ADHD.
Maybe
Okay.
Kirsty, hang on, let me say something. ADHD stands for attention hyperactive.
Attention deficit
hyperactive disorder. So those components are there. Now, what we use on the internet is normally screeners. They're just screeners, by the way. So you need a definite diagnosis from a practitioner. So a practitioner could be a clinical psychologist. In Kenya, clinical psychologists are not allowed to diagnose, but you can go to a psychiatrist, because psychiatrists are the team of people who therefore work with mental illness, specifically in our Kenyan context. And that is why in the many years, Mathare was there, the place to go then. Of course, now things have changed a little bit more. So it is important to know that what we use in the internet is more screeners.
Okay. There's still a number of questions and a lot within line with the mental disorders. So someone else asked, how long does it take to diagnose a mental disorder? They believe that they were diagnosed in a day and they believe that they've gotten a wrong misdiagnosis. Madam Torrance.
Sorry, I missed you. I think internet is fluctuating on my side. Sorry about that.
Okay, let me repeat.
Maybe just to remind people that sometimes internet fluctuates and I'm not able, so kindly allow me to clarify. Yeah.
Okay. I will repeat the question.
Yes.
How long does it take to diagnose a mental disorder? Someone diagnosed me in a day and they made me believe I'm a borderline disorder. I think they're basically asking how long does it take to diagnose someone, and if you feel like you've been misdiagnosed, what do you do?
There's always room to seek second opinion, and even a third opinion, and even a fourth if you're not satisfied. So that is the best solution that I can give to someone who feels there's a misdiagnosis. And it's okay to seek. However, it's important maybe to even talk to the psychiatrist how you feel about it in terms of the misdiagnosis. It's your life, it's your health. You take charge of it. It's also important to maybe even clarify what is it that is making them feel that it's a misdiagnosis. So it's okay to seek a second and a third opinion. And I think across that continuum, if they're all saying the same thing, that you want to ask yourself, why am I saying it's a misdiagnosis? If the three of them are saying a different thing, it is important also to find out what is it. But I believe there's room for second and third and even fourth opinion.
Thank you for that. The other question is, how does therapy help?
Who has his hand up? Sorry.
Okay. Sorry, yes, Mbugwa?
Yeah, I wanted to add on to what Madam Florence had said about seeking a second opinion. And that there's a short story that I have. So back in 2019, I was at my hostel, and then we took some bad food, and then almost all of us got food poisoning. So when each of us went to different hospitals, half of us were told we have cholera, another half were told we didn't. So with that, I wanted to say that if you feel like there might be a misdiagnosis, then there's no problem with that. And we also have to understand that human beings are capable of error. So there is a chance that there was a misdiagnosis either way. So if you feel like you have any problem, there's nothing stopping you from getting different opinions from different doctors to see. And if there's a lot of contradicting opinions, you could also mention that to the new doctor you're seeing, so that they can see if it's not this, then it might be this. So that could be helpful with proper diagnosis.
I've just seen a comment right now from the chat by Gashe, who said, I have a problem with self-diagnosis using websites because I could be having a bad day or a bad month. So the screeners would then declare me ill and would walk around telling myself I am ill. The diagnosis concept also takes power away from me and places it with the practitioners. I believe in looking at what the core issues are and dealing with those. I think what we've been trying to make clear throughout the event and so far is that one, therapy is treatment, and two, that diagnosis can only be done by psychiatrists. So if you want to get a conclusive diagnosis, also now we brought in the aspect of it's okay to ask for a second opinion. It doesn't necessarily mean that one doctor, one psychiatrist's word is law. That if you're not comfortable with it, you can actually seek help from someone else. So I'd like us to kind of break away from the questions a bit and now have a discussion on access to services and especially therapy services. So, Madam Florence, could you tell us how people can access therapy, and also how can they also access therapy at Strathmore?
So in Kenya at the moment, there are so many institutions, organizations, individuals who offer therapy. It is important to know that whoever you're going to must be certified by the Psychological Association. So there are many associations that in Kenya currently, they are about what? They're about 11 with different specialities. So you can approach one outside. So there are many, there are very many. Behind Strathmore, there's a Money Counselling Center. In Kenyatta Hospital, there are clinics there for therapy. But specifically in Strathmore, one, I mentioned that we are housed in SUMC, so the medical clinic. Number two, we are two. So I work with Dr. Lucy Muturi. So we offer the services. The charges that Strathmore University charges the students is 200 per session, because it subsidizes. And the institution feels that no one should struggle with mental health issues. Help is always readily available. So there's no particular structure in terms of you have to come on this particular day. So there's a phone line that we use. So there's a mental health line. Both Dr. Lucy and I have a mental health line. So you call the mental health line. And when you call the mental health line, a lot of times, because of the diary system, it means that maybe I might not offer you therapy at that particular moment, but we discuss it. Are you able to wait, or is it a crisis? Because when it's a crisis, I have to create space for you. But if it's not a crisis, then I can book you on another day, which works with many students. So crisis includes traumas. Most traumas are normally crisis. So maybe someone has been, someone is suicidal. I can't say, I'll see you tomorrow. It's an instant, and I have to attend to them at that particular point. Someone has been someone is in hospital, major issues, major crises, I have to attend to you. So that's the pathway to seeing a counselor in Strathmore. It's very easy. Sometimes you can walk into the clinic, you'll find the receptionist, especially now when we are not on the ground. They will always give you our numbers. And when you call us, sometimes, because of the busy schedule, sometimes it takes 24 hours to respond. But a lot of times we try to respond soonest. And that is why we have two numbers. So if you can't get me, you can get Dr. Lucy. If you can't get Dr. Lucy, you can get Florence. You can also leave a message and also indicate whether you're going through a crisis, then response is immediate. And if it's not a crisis, of course, I'll reach out to you within 24 hours.
Okay, thank you for that. Maybe just a quick question. For those who are not Strathmore students, do you know places outside the Nairobi or hospitals that they can actually access therapy services from?
A Money Counselling Center is just behind Strathmore, so they can access. Students in their universities, especially university students, should be having sessions in their universities. But for those who are not maybe in the university, or they're not in schools, there are many counseling centers.
Thank you. Even I think on our Instagram page, SU_Mental Health Club, we have a whole highlight called resources, where we've given different counseling centers that you can access or call, because we have the name of the counseling center and then the number, just in case maybe you're not comfortable with coming to the medical center, or you're not even a Strathmore student. I also wanted to ask, someone had also asked, how do you find a therapist that works best for you?
So a lot of times therapists, you see, you have to come to be able to hear, but most therapists, most psychologists or most counselors are able to work well. But sometimes you just don't, the connection might not be there because counseling is a very relational aspect. And for me, in my whole experience of work, I have never found a client who has come and said that this therapy doesn't work for me. Most of the clients who I have connected with, we've been able to find a therapy that works for them. So it is not them to go looking for the therapy. It's the therapist to advise which kind of therapy that works for them. So if somebody, for example, comes looking for a therapy called EMDR, I don't do EMDR, so I can't offer it to them because I'm not specialized to do it. So most therapies will measure around the 4 therapies that I talked about. So it's very easy to find what works. And as a therapist sitting at the end of this table, I can see clearly what works. Remember, I said it's ever behavior, it's ever cognitive, it's ever emotional. So those are the components. It's either psychodynamic. So those are the components that we work around. So the therapist will always advise. Unless, Christy, there's something they're looking for specifically from where they are sitting. That would be a different story. You're muted if you're speaking.
Oh, sorry, I had said maybe they can direct message you for clarification or direct message me, and then we can delve into it much deeper. Someone had also asked how long are therapy sessions?
Sorry, I didn't get you.
Someone had asked how long is a session. So for example, I walk into the medical center and then I call your number. How long will the session be?
Between 45 to 1 hour, ideally. But sometimes it's normally spills. A lot of times it spills. It spills over to, sometimes it spills over to 1 hour, 30 minutes. You know, there are people who will come for 2-hour sessions because that's what is able to accommodate their need. But generally sessions last for between 45 minutes to 1 hour. Once a week, because then it also gives you an opportunity to process. So we don't have sessions every day, no, once a week. And sessions are a process. So please don't come for therapy thinking that I will solve your problem or you'll solve the problem there and then. I normally tell clients that, remember, sometimes these clients, if you're going to go the psychodynamic way, sometimes this issue has taken you more than 10 years to acquire it. It can't take 1 hour to solve it, or it can't even take 10 sessions. So it's a process that needs patience and needs work. And that is why sometimes people come for therapy and they realize the work they have to put in, it's work. And they say therapy doesn't work. Therapy works. Therapy works. But it needs patience, it needs time, it needs understanding. It needs many components. Yeah, thank you.
Okay. Someone else had also asked, can they start therapy if then they don't necessarily have a mental disorder, but they've gone through a traumatic event, like losing a loved one, or they got into a car accident?
Absolutely, absolutely. Because you'll realize behind the accident, what's happening. Maybe we can look at that behind the accident, what's happening. And maybe using that example because it's very powerful. If you've ever been in a car accident, a major car accident, you'll realize it takes time before you get into a car. It takes time. Meaning what has happened? That you have been impacted in a particular way. And so it is important to go back and process what happened, process, because sometimes you realize you get nightmares. Where are those nightmares coming from? From the experience. And remember, trauma is not in the event, because the event goes away. Why do we still fear the car? Trauma is stored in our nervous system. That is where the mind keeps bringing it back. The body keeps bringing it back, keeps retrieving it and bringing it back. So it is important for people to process those experiences. And when trauma is not treated at the end, at the onset and managed, that's when we start having issues of post-traumatic stress disorder. So post the accident, what is happening? Yeah, thank you.
Thank you, Madam Florence. I have the next question. I think we can start in Mbugua just to give you a bit of time, then we come back to you. What ways do you think we can help youth open up about their mental health problems?
I think the best way is to spread awareness about what therapy is, especially with the men in the society. Because this reminds me of an interview that was done on NTV a few weeks ago. I can't remember when exactly, but they were talking about this. And for whatever reason, a lot of people in the society see seeking therapeutic help as a sign of weakness, or you don't want people talking about you, saying that your son is mad or your brother has gone mad since he's taking therapy. And I think that's the biggest challenge that's causing a lot of people not to seek help. And then until it's too far gone to the extent that someone has committed suicide or something close to that, or any other extreme measures. So yeah, I think awareness is the best way to go in terms of allowing the youth to begin therapy, or to begin embracing therapy rather.
Kirsty, there's awareness. You're muted, Kirsty. There's awareness, and also there's self-acceptance. Accepting that this is where I am, this is what is happening, this is the challenge I'm facing. And when we accept issues, it becomes very easy to deal with them. So we are moving past stigma. We are moving past being labeled, and you're owning the problem. I think at the end of the day, the youth and individuals must own that problem, because it's them who are being affected. And those are very key components when you combine it with what Mbugua has said. Yeah, thank
you. Just maybe to add a bit about that is also just to take away the shame in therapy, take away the shame in living with a mental disorder. I think, unfortunately, and maybe this is more so in the entertainment industry, the way they've painted people living with mental disorders is not it's not painted in a very good light. So it's very discouraging for someone who may display those certain symptoms, but because of how it's been portrayed, they're not really comfortable accessing services. So I think it's just taking away that shame and showing that once you receive treatment or are currently going through treatment, that it's okay. You can still live your life. You can even continue much better. And even like Mbugua said, you're able now to actually stop yourself when certain triggers or certain thought processes begin to happen. Yes. We are still open to questions.
Think about it.
Yes.
Think about it. Knowledge is power. You get to understand what is therapy. You see, most of us don't even go a step ahead to have the knowledge of what is therapy. And when you realize what therapy is, you realize it's not, what is it really? It's about you talking about your personal challenges and moving past them. So we also have to be knowledgeable and understand. I think one of the cancers that is eating us is lack of knowledge, and we perish because of lack of knowledge. What a shame for me. That's what I would.
I think it's so true. And even one thing I found very interesting about therapy, even as I received it in different points of my life, is that you go to therapy with a clear understanding that it's kind of like you think your therapist is your life coach to tell you So if I go with a problem, you go explain your problem to your therapist and you expect them to give you a clear, distinct answer. However, what you find is that through your session or through the therapy sort of makes you explore different options or different answers in which you can tackle that certain issue. They can also maybe show certain underlying fears that you're not even aware of that may have been prohibiting you or may have influenced how you react to certain decisions or certain scenarios. And also it helps you a lot, again, with stopping yourself sometimes, especially if you live with a mental illness, stopping yourself sometimes from certain negative or self-inflicting bad habits. Yeah. I think we can go to another question. What's the difference between counseling and therapy?
So counseling is the process. You see, I'm going for counseling. So the therapy, I would call it, is the bigger. It's a form of therapy. And you know, these words are used interchangeably. But if you think about the word therapy, therapy actually means healing. So when you're coming for counseling, you're expecting healing in the issues that you're facing. So in the therapy, because that's where we have psychotherapy, counseling, they're all therapies as the bigger umbrella. But they use different. So you'll find that psychotherapy, sometimes the way it's used and interchanged, and also depending on your orientation. So Dr. Lucy looks at it differently from me, but we are not far apart. It's just that in our context, when we use the word psychotherapy, we mean deep-rooted issues, deep that take quite a bit of time. Deep-rooted issues, deep-rooted that take years.
Oh, you've muted yourself, Madam Florence.
Sorry, it's very different from I'm struggling with classwork. So the weight of the issues, but even therapy, all therapies use a counseling process. All therapies use a counseling process. So it's a term that is interchanged, but it's not different. In the process of therapy, you go for counseling. In the process of counseling, you use the counseling skills, the counseling techniques, you know, but all of them are also used in therapy. So they're interchanged and they're one and the same. And remember, all of them work on psychological issues, even the process of counseling. Yeah.
Okay, thank you. I'd like to move back to you, Mbogwa. If you are comfortable sharing with us, how has therapy helped you beyond even just coping with your mental health? Do you find that it's actually affected different other aspects of your life, maybe your relationships with other people?
Yeah, I can say that my relationships with the people around me have improved. And also to an extent that now that I've become more self-aware of myself, a lot of people have approached me with various issues. And the easiest way I can say that therapy has helped me in the sense that I can also help other people to understand what they're going through and to acknowledge that they need help. And in the event that we are not able to, if I am not able to help them as a person, I can advise them and encourage them to seek help from a professional.
So also another question maybe I have for you is, have you felt shame sharing that you've been to therapy, like with your friends or your family? Did you ever feel shame about it?
Sorry, I had trouble unmuting myself. No, I never felt ashamed that I've gone through therapy. And it's not a secret that I've gone through therapy before. And I don't think I've ever felt any stigmatization towards it that I know of. But I noticed a lot of people seem to be very hesitant to let other people know that they have gone through therapy. Like, I understand that you don't have to tell everyone that you've either undergone therapy or you're going through therapy, but there should be a certain limit to how uncomfortable you can feel about sharing the fact that you are going through therapy. I think the biggest problem for those who find it difficult to say they are going through therapy, it's mostly the guys who are currently in the process. They are still healing. They haven't figured out what the issues are. But I think after you've become self-aware and you've accepted everything that has happened, that's when you are able to comfortably say that you have gone through therapy, you are still going through therapy, and such things. Yeah.
Okay. Madam Florence, I'd also like to ask you, what do you think about that? What do you think about the shame surrounding therapy and why people are maybe not so comfortable saying that they're seeking treatment?
There are many factors. First of all, let's look at familial factors. Most of us come from families where we are told our problems are our problems. We don't share our problems with other people. I don't know whether people identify with this statement. Shida zetu ni zetu, hatuambii watu, you know. So we keep circulating our problems. So we grow up, I think, with an idea that if you share something away from the space of the family, then it becomes, it's like you're shaming the family. So we don't talk about our issues a lot of times, and especially issues that are difficult. Some people struggle to listen to difficult issues. And that is why sometimes somebody will tell you, just keep quiet and seek therapy. So we shut people up as well. We are also uncomfortable as human persons looking at discomfort. Generally, at the public level, we are uncomfortable at looking at discomfort. And that now contributes to some of the stigma that people start facing. So we start labeling. No one wants to be labeled. No one wants to be shamed. We, at the basic level, at the core of the human person, we all want to be loved and cared for. We all want to be supported. It's a human need. We all want to be understood. And yet, the society is very judgmental in terms of, when you can't cope, what's your problem? You know, society is very judgmental. And that is one of the components that therapy offers. I am non-judgmental when you come for therapy. It doesn't matter. When you're able to move past the barriers, and the barriers could be stigma, could be shame, when you're able to transcend past that as an at an individual level, then you come to a safe space. You come to a safe space. And that also goes back to the individual. You must choose to transcend, because at the end of the day, the society will not help you when you're failing. So at a personal level, I need to also go and move past that stigma. And a lot of times I realize that when I'm doing the intake, there's a place I normally ask about the next of kin. I always notice that most students are very hesitant about that part. They always ask, are you going to call them? And I don't even want to know that I'm coming for therapy. And it's because maybe even at home, the way therapy has been diluted, it has been torn apart, and it has been made to look like such a bad thing. You know, it's the worst thing you can get into. Dare you embarrass our family by going to therapy? You see? So it is the many things, that the misconceptions around therapy, that stop people from coming to therapy. And for me, I still feel it's a shame. It's a very big shame. We need to rise past it. It's you struggling. Let's rise past it and grow. And grow. And it is us who can change the stigma. You and I, we have a responsibility because of the negative way that it has been presented. Remember, negative attitudes and belief towards people, unfortunately, are very common. It's just a negative attitude that affects everything, especially when it comes to therapy. And also remember, therapy is a new concept. It's new. It's a very new concept in our context. Traditionally, people relied on their families. Traditionally, the system supported people who are within the family, not outside the family. So families moving from in the family to outside the family has created a bit of stigma. And therefore, it's unfortunate. There are the different types of stigma that we have. So when we look at stigma, it could be associated with different things. Because look at it, even the differently abled in our context are still stigmatized, isn't it? We have not moved past it. When we look at issues of race and ethnicity, we still have stigma around that. So I think, and also mental illness, we still have stigma around it. So we have different types of stigmas. In the society, there will always be a negative view of something, a negative view about something. So it's individuals to rise past the stigma. Thank you.
Thank you, Madam Parent. It's interesting you mentioned that, because actually one of the main reasons we even set up the mental health hotline around 2018 is because most people told us they're not comfortable, that they can go to the medical center and they're going there to see a psychologist. They said they would rather die than actually, for example, if the receptionist calls out their name. So that was one of the solutions we came up with, is maybe just to have a line where students can call without that shame or without that stigma and actually receive help. So it's actually very unfortunate that even till today, with all this mental health awareness, that people still feel shame and stigma surrounding it. Someone had asked you
issues that I'm carrying. So can you imagine I'm a woman. So can you imagine sitting and hearing about another woman being raped? It affects me because I'm human. So I have a supportive arm called supervision. So I regularly connect with my supervisor. So Dr. Lucy and I, every week we connect, and then we debrief our experiences. Sometimes I even get stuck because I'm so ingrained